This week is Brain Awareness Week, and new data from the American Heart Association shows nearly 57 million people worldwide are living with Alzheimer's disease or another form of dementia. The hopeful part, though, although the number is climbing, the hopeful part here is that a lot of these factors, experts say, are within our control. So let's go to the expert. Dr. Robert Wiggins is a neurologist with Novant Health, and I'm really looking forward to this conversation, Doctor. Thanks for joining us here in the Live Impact studio.
Yeah, sure. Thanks for having me.
All right. So where do we start? I actually do want to start with when we talk about brain health. What are we talking about?
Yeah, well, of course, I think the brain is the most important organ of the body, and whenever we're speaking about brain health, we're really talking about interacting with the world. We're talking about doing the work that we need to. We're talking about being with our children. We're talking about the important ways that we're engaging with the people around us, engaging with the things that we want to do. Super important, right?
Mm-hmm.
As long as we're living, our brain is the thing that really brings us quality of life, brings us independence, and really makes life worth living.
So I just mentioned here that the number of folks who are living with dementia, some kind of form of dementia, including Alzheimer's, that number is climbing.
Yeah.
I'm reading 1 in 9 American adults over 65 has some form of it. What's driving the increase?
Yeah, and that's 7 million Americans that have some type of dementia. There's a lot of things driving the increase. I think the first is that we're all getting older in a good way because we're living longer, right? Mm-hmm. With medical advances, we're living longer, and what we know is that at least Alzheimer's disease, it's one of the major risk factors is age. The older we get, the more likely we are to have Alzheimer's disease or develop Alzheimer's disease. The other thought is that, for the most of us, we're not necessarily making the right choices, right? So whether that's our diet or our exercise, maybe we're more sedentary than we should be. There are a lot of things that are making us more and more likely to have either dementia, major cognitive impairment, or something like Alzheimer's disease.
So when we talk about heart health and that's good for brain health,
Yes.
how is that linked?
Well, I think it's linked in so many ways, right? What's good for the heart is good for the brain. Mm-hmm. Think about this. The heart is what's pumping blood through the body. And on the heart, there are blood vessels. Well, in the brain, too, there are blood vessels. And if those blood vessels on the heart are getting clogged, so are the blood vessels in the brain. And the problem with the heart is it can't pump as well. And then whenever the brain doesn't get the blood that it needs, whenever those blood vessels are tightened and smaller, the areas of the brain that we're thinking, recognizing our friends, family, that kind of thing, those aren't working as well. And so whether it's cholesterol, smoking, all things we can talk about, blood pressure, it is really, really important to take care of the body, the heart, and the brain.
So let's break that down. Blood pressure, cholesterol. How does that work with the brain, the levers?
Yeah, so what we know is this, that people who have higher blood pressure or too high blood pressure, folks that have bad cholesterol or too high cholesterol, the heart is not working well, the arteries in the heart are not working well, and those same problems that hit the heart will start to kind of gunk up the arteries of the brain. We actually can take pictures of the brain and see small areas of the brain that are impacted by what we call it chronic white matter disease, which is effectively, I don't want to call it mini strokes, but really small areas of the brain that just are not doing so well. They're not thriving. And what we know is this, is that if we can make those things better, if we can really impact them, lower our cholesterol, get to a healthy blood pressure, stop smoking, for example, our heart and body will not only be healthier, but the brain will too.
So we can reverse the white gunk in the brain by doing the right things and lowering the cholesterol and the blood pressure?
What I would say is that what we can do is prevent it from getting worse, for sure. Yeah, mm-hmm. I mean, the thought is, whether it's preventing or reversing, we got to do something now, right? We got to impact things now. We got to make a difference. And there's a lot of ways that we can do that.
So let's talk about early detection, or once you realize maybe there's a decline of some kind. What are the signs?
So there are a lot of different signs of dementia, a lot of different signs of cognitive impairment. We typically think, or most people say, oh, I'm having memory trouble. Now I forget where my keys are. I forget where things are. I forget what I was thinking about names all the time. And that does not necessarily suggest dementia, but it's really whenever we're having more meaningful cognitive changes, like forgetting to take our medications or having trouble with our finances or maybe not recognizing a family member, getting lost. Those are some of the things that are really major signs saying, hey, this is not just something, this is not a normal thing about getting older, right? This is not a symptom of aging. This is something like cognitive impairment or dementia. That is the time whenever someone needs to go to their doctor, talk to their spouse, for example. And the thing is that, in the past, we honestly didn't really think there was a whole lot that we could do, right? Mm-hmm. We could be supportive, we could add some medications that maybe just help the symptoms a little bit. But I tell you what, times have changed. the things that we can do to try to actually slow down the progression of something like Alzheimer's disease are a lot, right? Even in the past 2 or 3 years, there are new medications that have been given to really try to slow down that progression. And what does that mean? That means better lives in the future, right?
Yeah.
That means higher quality of life, more independence for the future.
When I think about aging and wanting to be the best version of myself at 70, 80, going into and living my best life in my golden years, talk to us about, that actually starts now in mid-age or even younger.
Yes.
And how do we do that?
If you have a brain, you should be protecting it, right? And so the thought there would be whenever someone's young, we think about things like, let's really focus on education, right? We have some evidence that shows that the more educated someone is, the more exposure to education they are, the better their brain will be in the future, right? The less likely they're to have dementia. Now, it's kind of a hot topic issue, but we talk about concussions, brain injuries, right, with sports. It's really important to protect our brains, right, even whenever we're playing sports. And then we get to that kind of 20s, 30s area where we may think that we're a little invincible.
Yeah.
But in our 30s, we start to feel like, oh gosh, life is coming at me really hard. And that is not too late, and it is not too early to start trying to make some of these changes. So
Yeah.
whether that's really focusing on trying to improve our cholesterol, improve our blood pressure, making sure that we are sleeping well, and making sure we're getting really good exercise. It's actually part of something called Life's Essential 8, the American Heart Association talks about. Just saying, hey, let's make an improvement now. Let's really try to intervene now. It is not too late, and it is not too early to start caring about your brain.
Is there an emphasis that should be put on nutrition over diet or vice versa? What's your prescription?
Yeah, so actually the Alzheimer's Association, excuse me, recently came out with this thing called the Brain Health Recipe. And one of the 4 things it focuses on is nutrition. And one of the best diets is called the MIND diet. Now, it's a little bit similar to the Mediterranean diet and something called the DASH diet, which is really good for the heart. And what it does is it actually slows down the neurodegeneration or brain problems, right? So it's really important that we focus on that type of diet. Now, the important thing with this diet is it's not necessarily this kind of crazy change your diet, weight loss type thing. It's small changes. So it talks about 10 things that we should try to increase in our diet and 5 things that we should try to decrease. Now, one of the most important is dark leafy green vegetables. That's spinach and kale. And we all know that we can add some of these things to our diet. That's something that I've been trying to do lately.
I got a spinach salad in the refrigerator waiting for me,
There you go.
Carlene. You got
Good for you.
Carlene's a good
I've
spinach
got greens,
girl.
I have spinach.
You got your greens ready to go.
Arugula.
Arugula.
Yeah, you know.
All the leafy dark
That's
greens.
what you need.
All right. Sugar. We're hearing a lot about taboo with sugar. What is? I'm sure you're probably going to say try to lower or put a cap on your sugar intake. But why is sugar bad, or we
Well,
have to watch it?
I mean, I'll say this first: life is good and life is worth living, right? And so I don't think we necessarily have to say, "Oh, 0 sugar, 0 chocolate chip cookies." I mean, life is good. We should have those things. But part of the thought is moderation, right? And what we know is that sugar, increased amounts of sugar, can lead to things like diabetes, and we know that diabetes can increase our risk of brain issues, dementia in the future. The thought is this, is maybe we try to change our framework. So rather than thinking about sugar or other calories being, really bad for us, what if we think about it as fuel, right? And so we're eating whether it's that spinach salad that you're having or whether it's a little extra sugar in this, we're using it for fuel. And so I don't think they have to be avoided altogether, but the thought is this, is we have to figure out how we're going to take care of our brain. And that may include reducing our sugar intake.
I have so many other questions, and I'm kind of forgetting it because it's happening so fast. How about, people are taking these body scans and looking at their, I don't know.
Yeah.
Everything.
All of that, right? Yes, no, doesn't matter.
Too much.
Controversial, yes.
What I would say, this is inspiring. There are so many new ways that we can try to take care of our health. The way of dementia, the way of Alzheimer's disease, the field is changing completely, right? And so there are a lot of ways that the field is changing, and there's so much new research going on. From my understanding, the body scan type thing is not necessarily really focusing on brain health. I think that some folks would say, hey, that's the way to go. Others would say not. What I would focus on is what I would say is the research and our evidence. What we know is that there are things that we can do to make our bodies better, our hearts better, and our brains better. And those are the things we've talked about so far.
How about genetics? If both or one parent has some form of dementia, what are the chances that you are going to get it? And conversely, that you don't get it? What can you do?
Yeah, so you had mentioned those, modifiable risk factors. Well, genetics are non-modifiable risk factors.
okay.
So we do think that genetics does play a role in someone's likelihood of having dementia, Alzheimer's or otherwise. The thought, though, is this, is that rarely is that a foregone conclusion, right? If you have a genetic risk, that's a risk. That doesn't mean you have a genetic, guarantee that you're going to have dementia, Alzheimer's, or whatnot. So my thought is this, is that if you do know that your family has that, has a more likelihood of having dementia, or you know that you have the genetic factors, that doesn't mean you give up. That doesn't mean that you expect or plan or put on your calendar that you're going to have Alzheimer's disease in a few years. What you do is you start now, right? And you start making changes now. You try to take care of your brain now, the things that we've talked about. I think that there are so many ways that we can optimize our brain health, optimize the way our brains are working even now. That's what I would recommend. Not all dementia, not all Alzheimer's is genetic. And a lot of folks are going to have these things not because of the non-modifiable risk factors, but because of the modifiable risk factors.
Oh, really?
And so it's really important to modify the things you can modify and maybe, let go of the things you can't.
Okay, so I know you've had sprinkled some messages of optimism, things you can do. Medicine has come a long way. What, for the folks who are dealing with this firsthand right now, what do we tell them today? What's the message?
I think there's two audiences here. There's the person who has dementia or who's developing dementia, and also the caregiver, the loved one. And the messages may be a little different. The message for the person who has dementia would be exactly what you're saying. There is hope and there is optimism. The nature, the game, the field is changing dramatically. We have medications now that we can give that will slow down the progression of Alzheimer's if we're giving those at an early stage. And those were not available recently, right? And so the future is bright. If you have Alzheimer's disease, if you have dementia, it's challenging. But I do think there are really exciting things coming around.
Good.
If you're someone who is caring for the other person, your loved one who has Alzheimer's disease, my thought would be this: hold on, take care of yourself, and look for support. It is not a solo task, right? It's a partnership, and you need to find a team. Your doctor and the doctor's office can be a team, but you got to really find other team members to be there for you. You got to take care of yourself too.
Yeah. I mean, it definitely takes a team and a village, as we've seen. Some of the celebrities like Bruce Willis, who definitely put a face to some of these diseases, gives us kind of an eye, a look into what can happen and what they're doing about it. So for better or for worse, we get to kind of take a peek at what they can do and what we can do for ourselves.
If I could say, I
please.
think a lot of people, we talk about heart attacks, we talk about strokes, but what people fear is dementia.
Yeah.
Because what that means is that you have the body that's working, but your brain just is not working. And I think that, we say that, of course, fear can be a driving factor, but I would turn that around. Like, what if rather than fearing dementia, fearing Alzheimer's disease, we focus on trying to provide a healthy brain for ourselves in the future, right? If we say, hey, here are the things that I can do to try to make sure that in 20, 30 years, I am there for my grandchild's high school graduation, that I can be present, that I understand what's going on. And so, fear is an important motivator, but I think also the hope of a great life and really good brain power is so important for the future too. And so the thought is, don't just be afraid of what could come, but be excited about the ways that you can take care of your brain and be excited about the way that your brain can work in the future too.
Does that include doing crossword puzzles every day?
It's
Carly,
a good question. Hey, my
right?
mom, shout out to Jan. I know she's
Hi-
watching right
hi,
now.
Jan.
She's like, I do crossword puzzles.
So
and
my husband
Sudoku
as well.
and to keep her brain
Sudoku,
sharp.
yes.
Is brain teasers?
They certainly won't hurt.
They won't
Let's
hurt.
say that,
Yeah.
I mean, what we know is this, is I talk about this, is we got to stay cognitively engaged. And so the way that I say is if someone's having a little bit of brain troubles, they should be the one to order the pizza, right? They should be the one to call and actually answer these complex questions, or they should be the ones that are really challenging their brain. I do brain teasers, right?
Okay.
I think the other comment, though, is this, is sometimes TV is great and just like watching, binging, whatever. But the thought is this: is what about something that's actually going to challenge your brain, right? What about something that's going to really engage your brain, whether that's reading or conversations, staying socially engaged.
Socially engaged.
Those are really, really important. And what we know is that whenever people become more isolated, particularly if they have hearing loss, right? Hearing loss is an awful thing that can actually make us more likely to have memory trouble, cognitive impairment, dementia. If we can move away from social isolation, move away from those type things, and engage with our community, engage with the people that we care about, our brains will be better, right?
Mm-hmm.
And that social engagement, that's a form of cognitive engagement, cognitive exercise as well. But keep doing the crossword puzzles.
And the sleep thing. A lot of people are challenged with sleep. I love that this is a topic. It's, people are always talking about trying to get more sleep and why they're not sleeping and the blue screen and all that. But help us out.
Well, I can tell you this. I didn't get enough sleep last night, and you guys may not have either. So it's something we're all working on. The thought is this, is that we've started to learn that maybe sleep is not just what's resting the body, but it's actually resting the brain, and it may be actually cleaning the brain. And so some of the parts of the brain that may be detracting from our brain health can be cleaned out actually while we're sleeping. Yeah. And so it's not just quantity of sleep, but it's quality of sleep too. And there are so many things that can impact sleep, whether that's something like sleep apnea, but also depression, anxiety. I have a lot of patients that wake up in the morning at 2 or 3 a.m. and they cannot go back to sleep.
That's me.
Yeah. And, I'm not saying this is you, but that could be work stress. That could be family stress. That could be depression. There could be so many different things. And the thought is this, is that sleep is important. And I think for far too long we have just gotten by, right? Whether it's that kind of popular kind of like grinding culture or just get after it. Sure, that's good in your 20s and 30s, but then there becomes a point when you actually need sleep. You need to take care of yourself. And sleep is so important, and we all should probably be trying to get more of it.
Oh, for sure. Amen to that. Any other questions from the room? This was great.
I think I'm good.
Yeah? All right, to spinach salads.
Spinach salads, arugula,
Sleep,
and
arugula,
Sudoku. That's what I'm going to be doing. Yeah.
All right, Janet, keep on going with your brain teasers. Dr. Robert Wiggins from Novant Health. Thank you, talking about heart health, brain awareness health. They go together. We're going to do all the things we can so we can live a great life well into the golden years. All right, appreciate that.